Hey, can you just chill, baby?
Hi, welcome back, or welcome. I am Suzula. This is Sophie. And today we're going to talk about ending stigma around addiction. One of my missions in life, personally, professionally, is to end stigma around addiction. And so I'm going to talk about 5 specific ways that you can change the way you speak about addiction to do that. I mentioned that I'm in recovery from addiction, and I'm also a lawyer. And one of the things I do is I teach legal professionals, lawyers, judges about addiction. So about the neurobiology of addiction, about the fact that it's 40 to 70% genetic, the role that trauma plays, and this piece that I'm going to talk to you about, which is language. And so I'm going to go over 5 things that I think are really important. The first one is stigma, the word stigma. That's just the nice way to say, or not the nice way, the layperson's way, the timid way to say discrimination. Stigma is discrimination. If we discriminate against someone who has a physical handicap, we don't call it stigma, it's discrimination. And so whether we're talking about under the Americans with Disabilities Act for people who have addiction and who have been in recovery, been abstinent, or been their use has been non-problematic for a period of time, or just in general, discriminating against people for having the disease of addiction is discrimination. Second, addiction itself. Addiction is what we've always called it, right? Addiction, alcoholism. Well, as of the publishing of the DSM-5, the Diagnostic and Statistical Manual, edition 5, which is the guide for physicians about how to diagnose things and what the codes are, addiction is actually substance use disorder. It's a spectrum, which runs from substance use to full-blown substance use disorder, or what we would think of as addiction. 80 to 90% of people who use drugs or alcohol don't develop a problem. So there's substance use, substance misuse, substance abuse, and finally full-blown substance use disorder. And so we need to start talking about it that way, again, in order to call it what it really is, and also to move away from this criminal shame paradigm. 3, addict, alcoholic. When they started 12-step fellowships, the medical community had no idea what addiction was. They thought it was a moral failing. They thought it was a lack of willpower. We have come so far, and we now understand that it's a brain disorder, that trauma plays a role. It's 40 to 70% genetic. And so we need to reflect that in our language. Back then, because the only recourse people had who had substance use disorder was fellowship with other sufferers, they'd get in a room and they would introduce themselves as an alcoholic or an addict for 2 main reasons. 1, to admit they had the problem, and 2, to identify with each other. That's still fine in a 12-step context. I'm not saying anything about that amazing program or fellowship. And in the world, we need to say, I am a person in recovery, because it's person-first language. We don't call someone with depression a depressive. We don't call someone with cancer a cancerian. We call them a person with depression, a person with cancer. And so I am a person in recovery from addiction and depression. And I usually say addiction just because people know what it means. If it was perfect, I would say I'm a person in recovery from substance use disorder and depression. 4, clean and dirty. This is a big one in the criminal legal system. Notice I say criminal legal system, not criminal justice system. I'll get to that sometime down the road. Especially in the context of drug testing, if someone is on some sort of probation or supervised release, they are having their either urine or sweat or breath tested for the presence of drugs. And even in a court of law, people, judges, prosecutors will talk about, oh, they're clean, they're dirty. That's completely shameful and pejorative. We need to talk about a drug test, the results being positive for the presence of substances or negative for the presence of substances. And furthermore, we need to stop calling people clean or dirty. 5, and this is a big one for me, is medication-assisted treatment or medication-assisted therapy. I am a beneficiary of medication-assisted treatment. Way back, I'm not going to say the year, but way back before, actually when I was in college, I was addicted to heroin and I couldn't stop. I went to treatment, did nothing. and I got on methadone. I ended up being on methadone for 4 years, and I ended up graduating from Barnard College on methadone. And it saved my life, because what it did for me, first, it made it possible for me to stop using because it took care of the withdrawals and the cravings. And then as I stabilized on the medication, I was able to focus on recreating my life. And admittedly, once I got off methadone, it wasn't long before I relapsed, but I relapsed on uppers. I relapsed mainly on methamphetamine. I never went back to opioids. And I think one of the ways to understand this is when we think about harm reduction. We can't always get people to go straight to abstinence. It's just not possible. So does that mean we just throw them out? Oh, never mind, we give up? No, it means we do what we can to move them towards a better place where they're doing less harm to themselves and less harm to others. So think about smoking. You're a smoker and you want to quit. I'm going to go cold turkey. It's going to be really hard. You're going to be cranky. Go for it if you want. Or you can use medication-assisted treatment. You can use a patch. You can use gum. You can use one of the medications. Zyban, I believe, is one of them. And what that does, just like methadone or Suboxone, which is commonly used now, is it takes care of the cravings and helps you stop that habit. Stop buying cigarettes. Stop smoking. And once you've changed that habit and built new habits, then you're able to, if you'd like, go off the patch or the gum. I know people who still chew gum years after they quit smoking. And it's still harm reduction. They're still in a better place than if they're smoking cigarettes. I feel so strongly about all of this because there's so much, we have this opioid crisis in this country, and there's so much ignorance and shame around medication-assisted treatment. Another thing about it is that it's not just the medication. Medication-assisted treatment involves the other services that you get with abstinence-based treatment. Counseling, group therapy, any other wraparound services. It is not simply substituting one drug for another. And again, I am living proof. So just to review, the 5 things are, first of all, stigma. It is not stigma. It's discrimination. Second, it's not addiction. It's substance use disorder. Third, I'm not an addict or an alcoholic. I'm a person in recovery from addiction or from substance use disorder or depression or cancer or whatever it might be. 4, clean and dirty. I'm not dirty if I were to relapse. I'm not clean because I'm not using drugs. I'm either abstinent in recovery or I'm not. If I were to undergo drug testing, it would come back either positive or negative for the presence of substances. And again, medication-assisted treatment, so important to understand. What I usually say to people when they immediately jump to that place of judgment, I say, well, do you have opioid use disorder? Well, no. Are you a medical doctor? Well, no. Well, then do your research, because the research clearly shows that it's beneficial. It reduces overdose deaths. It leads to long-term better outcomes, greater likelihood of recovery and stability. And as you can see, I am so passionate about this. So while it may not have been as fun as agate hunting or stenciling, I'm really glad you're tuning in, and I really hope that you'll share this information with the people you work with, the people you live with, the people you care about, because we have got to end discrimination, and we have got to move towards public health paradigm when it comes to substance use disorder. It does no good to send people to prison for having a disease. We need to give them medical treatment. So thank you so much for tuning in. Like and subscribe, and I'll see you again soon.
Thanks.